Thank you very much. On behalf of the study team, I'm very happy to present this study that was done in collaboration with the Lums University of Pakistan. So, go to the next slide, please. So, as we know, malaria continues to be one of the leading causes of mortality, communicable mortality, with over 500,000 deaths annually, according to the WHO. And with 250 million new cases every year, nearly half of the world's population remains at risk of infection, those living in high transmission regions of Africa predominantly, and in some parts of South Asia and Latin America. So with projections of an additional 250 million excess deaths by the end of the decade attributed to climate-exacerbated transmission. So this is also considered a key contributor to global climate health burden. Although we know that malaria is preventable, heterogeneity in socio-demographic, environmental risk factors over time and space make prediction and modeling in general challenging. So remote sensing-based data-driven approaches, accounting for spatio-temporal variability, could offer potential for scalable, low-cost, location-specific early warning tools to support experts in malaria outbreak assessments. So in this case study, which focuses on South Asia, which is home to roughly 1/4 of the world's population and has a high climate vulnerability index, we developed and internally validated a data fusion approach using information from over 32,000 districts from Pakistan, India, and Bangladesh, using remotely sensed environmental and geographical indicators. And the outcome here was to generate predicted estimates of district-level malaria incidence. To do this, we use freely available open source data derived from Earth observation reanalysis products listed here, including average annual temperature, rainfall, vegetation, and nighttime light intensity. These were then linked to malaria rates provided by the DHS dataset at specific latitude and longitude values. The malaria and environment linked data were then curated into a bespoke spatio-temporal format where country-specific batches were created representing time, space, and each of 43 different predictive variables. A multi-dimension long LSTM model was then developed using an 80-20 train test split ratio. Country-specific models were produced for Bangladesh, India, and Pakistan. Separately, univariate heat maps of each environmental indicator were also plotted against malaria rates. Qualitative and quantitative model performance was assessed using regression error rates. So first, these univariate heat maps where malaria incidence rates for a given year are depicted in red against average annual temperature for the same year on the left side plot and rainfall on the right side plot. And we can see that in general, from 2000 to 2017 over time, a greater concentration of malaria incidence could be seen in districts with higher temperatures in general and higher rainfall across the 3 countries. Similarly, for vegetation, high malaria incidence was concentrated in areas with highest vegetation. However, in contrast, on the right side, you can see nighttime light intensity, which was found to have an inverse relationship with malaria outbreaks. So regions with high nighttime lights had less incidence of malaria cases as well. And this is opposite to the relationship found with each of the earlier 3 indicators. So in terms of the performance of the proposed model, which was based on a fusion of temperature, vegetation, rainfall, and NDVI, these bivariate heat maps here show that where high case rates were correctly predicted in the regions in purple, dark purple, and areas where low case rates were correctly predicted as well. So the regions in light gray and white are low case rates, but also correctly predicted. In pink, we can see areas that were high case rates, but were misestimated as low case rates. So that's the inaccuracy. In terms of overall accuracy, you can see on the right side plot, cases that were correctly identified are shown in black. So in terms of quantitative model performance, prediction accuracy and root mean squared error were produced in agreement, and the results are in agreement with the qualitative maps. And you can see that the proposed model, the one shown in red, has the lowest regression error as compared to the reference model, which was the convolution LSTM, which is a benchmark model used in weather forecasting. So, some strengths and limitations. Obviously, this case study was undertaken in three countries of South Asia, um, which, although together account for a quarter of the world's population, facing fragile and overburdened health systems. But further investigation in diverse climatic regions should be studied, particularly in the WHO Africa region, which has the highest burden of malaria with over 90% mortality, which is ongoing work, and input into this is welcome. Then versatility of data fusion, readily available Earth observation data, and high performance compute rendered the proposed approach to be both geographically scalable to other regions as well as generalizable to prediction of other communicable diseases as well. So that's the power of open science enabling rapid and reproducible research by scientists everywhere. So, in summary, malaria incidence can be forecasted using remotely measured environmental factors with a high accuracy and speed. Data-driven approaches using freely available open source data that enable simultaneous forecasting ahead in time as well as across geographical regions could offer potential for scalable, rapid, and cost-effective location-specific early warning tools for malaria. And this in turn could aid regional decision makers to manage outbreaks early, especially in resource limited settings and climate vulnerable settings. So, thank you very much.